smart, man. It looks like it's just you and me right now. I sent out an invite to this group I'm in. Just go
Sweet.
ahead, and I did a post as well. I would say post it also on yours, and let's see what we can make happen. If not, we'll just go ahead and kind of just do what we typically do. How's your day been?
It's great. Yeah, well, we could just go for it. People could come on if they come on. Um, Good actually. Yeah, a good day. A little bit busier today, but dude, my rotation right now, I'm at the dental school, and it's kind of like the closest I'll get to a 9 to 5 through residency, which is, dude, that's a breath of fresh air. You know what I'm talking about.
Yeah,
Yeah, man. How was your
that's
day?
good, man. Oh, that's good. We had our oral surgeon in the office, and he had a half day today. Things are kind of slowing down pretty much everywhere, man. Like I was talking to him, and I was asking him how's it because he travels office to office, and I was asking him how it is at other offices, and he's like, "Man, these past couple months, everywhere it's been slowing down."
Really?
And yeah, and he's like, "Dude, people just they can't afford shit anymore."
Oh, yeah. Oh, man. It's funny because the city hospital they're at right now, they increased their implant prices. Now, at the city hospital, let's leave the name out. Let's leave the whole thing out. But at the city hospital, it was $400 an implant. $400 an implant. Now that's just the
Yeah,
implant, sure. And then you say, 400 for the abutment, 400 for the crown, but that's 1,200 for an implant. That's extremely affordable. And they just upped it from 400 to 650 an implant. And
yeah,
now you think that that's not that much, but remember that's increasing the implant, abutment, and crown. So now it's a $1,900 deal. That's $2,000. So now we're like, it's a grand initially. You could swing it. You could definitely swing a grand. That's like you need to get a new iPhone, you need to get a new tooth, right? You can swing it, but now it's $2,000, and you know you like just barely got groceries last month, and your rent is due in 10 days, and you're still not ready for that. It becomes a different conversation when it goes from one to two thousand
yep,
dollars for an implant, and I don't know. It's
yep.
just you know what I mean.
It absolutely is. Hey, oh man, we had a listener for a second. I don't know if you saw that
I
they
saw
came
that.
on. But yeah. No, dude, I totally get it. It's impacting a lot of people, and it's unfortunate
Well,
because
your oral surgeon though, like, what else is he doing? So you're doing all arches with him, right? What else is he doing though? Because that's what they're not going to be able to afford.
wisdom teeth, single extractions, full mouth extractions, full arch, bone graft membrane. Um, it's more so now like unless the person's in pain,
Oh yeah, they
they're
want to
not
keep
going to
it.
necessarily, yeah, they're going to go ahead and kind of avoid that. Like before, there'd be an infection or if there's a broken tooth and the person's not in pain and you let them know this got to come out, they'll be
Mhm.
like, all right, let's go ahead and do it. Now
They don't want to do it. Oh, I see that a
yeah,
lot too. It's got to be covered
and
by insurance, or they're not doing it.
yeah, and they'll choose lots of times not to get bone grafting, or they'll say, you know what,
Hmm.
I'm gonna wait off on this for a month. How long? And they always ask, like, how long can I wait on this? I'm like, dude, I don't recommend waiting. I'd say we take it out as soon as possible.
Yeah.
And I see the same thing on like our endodontist schedule. Like they'll kind of push it out 2 weeks or a month or so. And lots of times these people they end up calling back like a week and a half later because they're like, "Fuck, I'm in so much pain." But yeah, if it was up to them, they would wait as long as possible now.
It's just it's dangerous. I'm not gonna lie, it's dangerous because you know where they go when these things actually flare up.
Yeah,
When it's like a big infection, they got to go to the emergency room, and
yeah,
then it's a whole thing. Oh man. Uh, Sometimes they get a trach if it's that bad. The complications in the hospital, uncontrolled diabetes. Yeah, if they're not taking care of their teeth and they don't have a good diet, don't have a good exercise regimen, they got uncontrolled diabetes. Perhaps now, a little simple infection that IV antibiotics fixes up and your body fights it. Now, 3 to 5 day hospital stay turns into we've seen over a month in these poor patients with uncontrolled diabetes, and
yeah,
it's really it's sad to see how finances, oh, that's another thing. Finances play a role. You can't just get a free iPhone.
Bidenomics, man, that's what it is.
Ah, yeah. Isn't
That's the thing.
the debates tomorrow? No?
It is tomorrow, yeah.
Oh man.
Be exciting. See how it goes. It's election season and things are heating up.
Oh, they're heating up, all right. Everything's heating up. It's kind of scary.
It is, man. The world is burning to the ground. I was reading today, literally, like earlier today, there was an attempted coup in Bolivia, and I guess it had failed. So it's like shit like that's going on all over the world, like all the
Yeah.
time now.
Yeah.
People really don't realize, like, leadership, stability in the world comes from leadership at the top. And, like, when you're the president, you are the leader of the free world. And if that's out of control, then everything is out of control as well.
It's so true. I mean, we have proof. The proof's in the pudding. It's oh man, it's crazy how all the pieces are connected like that, you know?
It really is. And I mean, it's cool that the world is so interconnected, but it's also scary as well that that's the case.
Yeah. I'm so surprised at how well, one, how mainstream media has had such a lock on it for quite some time, more than we realized, you
Yeah.
know? And then things started to open up a little bit. I don't want to get too into politics, but not too much into politics. But what's another crazy thing is how there's been such a like a concerted effort with all these, like what's going on in the US right now. It's happening in Sweden. Sweden's now, I just read, is now I think it's not Stockholm, it's one of the other cities in Sweden. It's now one of the most dangerous and violent, with crime happening through the roof in Europe. In all of Europe, Sweden was one of the safest up until the last handful of years.
Yeah.
It's now one of the most dangerous, and it's crazy how things could flip on a dime like that.
Yeah, it is. It's the immigration is the biggest problem there.
That's what it is. There's a big but there's been immigration in all these Western countries, like through the roof. It's a concerted effort. There's something bigger behind all this.
It is. They're putting politicians in place who support this to basically topple these countries from the inside out. Like, because let's be real, like NATO and the US and all these other like Western countries, they're not going to be invaded. Like China and Russia, they're they know they can't invade. But for the same reason Rome fell, it fell from the inside.
That's right.
And that's the exact same thing. I mean, if you cripple the population from the inside, then you can do some sort of an attack from the outside.
That too. They can be invaded if the inside is on a foundation that's quicksand, which is what it looks like. Yeah, I agree with that. Dude, did you ever end up watching that Ray Dalio 45-minute documentary I sent you on the changing world orders?
Yeah, yeah.
Dude, it's
He's good.
everything you were saying. You've said all this for years now.
It's the fourth turning. That's what it is. It's those cycles.
Yeah, man. Well,
We're here,
sparing,
man.
yeah, sparing the details. I've been loading up. I mean, I did Bitcoin. I did the other thing you recommended that, um, but what was the most recent thing you said? I forget that we should.
Guns, baby, guns.
No, the one after that. The one after that. Just recent. Like last week, I asked you.
Bitcoin, probably.
Bitcoin was first. Bitcoin, you told me maybe
Food.
even a year or two ago, and then the next thing was about a year ago, and
Food.
now recently,
Stock up on
food.
food.
Food. That's what you said. You think there's going to be a food shortage?
Yes, I mean if things get bad, like absolutely.
Look. You've been spot on with Bitcoin. A number of things. Guns is scary. I'm very concerned about that. I'm really hopeful you're wrong about that. But the food thing, I just saw a study that MIT did in like the 1970s, and they predicted a massive food shortage by 2040. It was a graph, and it had several factors. It was like food. It was like jobs, it was housing, this is like all the things we look at. And yeah, food was not wiped out, but it was extremely, it became shorthanded by 2040.
Yeah, it's wild. It's wild to see. But hey man, well, I think you want to cut this short right now?
We can, yeah, whatever you want to do, man. I'm recording.
Yeah.
I got this for a podcast.
Okay, perfect. Let's I don't know. We got to figure out this spaces thing cuz I think it's got a lot of potential, but at the same time, I don't know. I feel like there's just not a lot of dentists on Twitter yet.
Oh, here we go. Dr. Chomper's on. Dr. Chomper, let's join. Let's join. Let's get him in the chat.
There we go. We got him in.
How can we get him on the mic?
He's got to request himself. So if he requests, then
Chomper, request. Come on, come in the combo. I'm recording this for podcast. I'm putting this out on. I'll be putting this out on YouTube and podcasts, obviously. Chomper, what's going on?
got the silent treatment.
He's got a request. He'll do it. He'll do it. Let's hop in the chat. You excited for the debate tomorrow? You gonna watch it? You gonna listen to how? What do you got planned? Oh, Chomper's gone. Damn.
Honestly, I'm gonna watch it. Probably watch kind of the highlights of it because I think I'm gonna be busy around that time.
Gotcha. Gotcha. Yeah. Probably gonna do the same thing.
Yeah. Well, I guess we tried there.
Yeah,
So,
it's all good. We could always try Instagram Live.
okay, well,
We could
he's
do.
back. He's back. Let's see if we can get him to come on.
Oh, there we go. He requested.
Let's accept this. What's going on, man?
You're on
Mike's
mute.
off.
There it is.
What's up, boys?
What's going on?
I had to get the AirPods. I was on the PC, but couldn't get the mic figured out.
No worries, man. Welcome. This is the first time we've ever done anything like this, and as you can see, it's a huge success.
Yeah, you put something comment or a name Teeth Talk on there.
Yeah, we gotta start somewhere because I think these like spaces for like crypto communities, finance, and all that stuff. They're popping, but I think a lot of it has to do with there's just not a lot of dentists on Twitter yet.
Yeah, we got to get Peter in here. Give us one of his spiels.
That'd be great. We got to do that. We got to get some people going. I mean, spaces, podcast. I'm down for anything.
Yeah, if we get these things hopping, Peter hop in here, he'd love it.
Yeah, I'm. By the way, I'm recording this on Zoom, so it'll go up on podcasts and YouTube channels. But what were you gonna say? I'm sorry.
No, nothing. Go ahead.
No, yeah, just dude, we gotta make content, boys. We gotta get these discussions going and talk about dentistry. Pat was just saying how some of the dentists and surgeons in his area, everything. I haven't seen this as much. I'm still in residency, but he was saying that there's been kind of a little bit. Oh, someone just popped in there for a quick second, but it's starting to get tight with things. Patients don't want to fix their teeth up because they can't afford it. It's not good.
Yeah, and that's, I come from like blue collar America, so it's a lot of that. Okay, you need this crown. 3 years go by, finally something breaks, and then now it's a priority. So they didn't want to fix it. They feel like money's tight until there's a problem, and then at that point, it's either half and half. That some will be like, okay, yeah, like what are we gonna do to fix it now? And either it's too far gone or whatever that may be.
Yeah, I'm curious. Like, are patients going to start getting treatment too, and then just not ever pay for it? Is that going to be a thing?
Yeah, that happens.
Yeah, Pat, are you PPO or are you more fee for service?
PPO, and
Okay.
At the end of the day, like you're gonna have people have their out of pocket, and what we're seeing now are like default rates for whatever it is that they owe is increasing. people, we put them on a payment arrangement for 6 months, a year, something like that. And they'll pay 7, 8 months, and then they're just not able to afford the rest for whatever reason. And it's unfortunate. That's why, like, ideally, you want to have patients get approved by like Care Credit, because if they get approved by Care Credit, you pay a fee to Care Credit, but at the end of the day, if they can't pay, it's not your problem. They've paid you. Care Credit had fronted all the money. Care Credit's going to be the one that's going to chase after them. And so that's the thing, is you're seeing a lot more denials for these Care Credit applications, or their limit is not as high as it used to be. So before it would be, let's say, $4,000 for a couple crowns, they'd be getting approved for all of that. But now they're only getting approved for 2,000.
I see. I see.
Yeah. So
Are you in-house financing, or are you using a third party like Sunbit or like Alphion?
we use third party, and then we also do in-house as well. And for in-house, like, we require a pretty big down payment for these patients. And that's the thing. It's like, and we only do in-house if they don't get approved for like Care Credit or third party, or they just can't outright afford it with their credit cards or whatever else. But then the thing is like, okay, well, they got denied from all of that stuff, right? And now you want to put them on like an in-house payment arrangement. Like, how are they going to afford that? Like, you're having monthly payments of $300-$400 sometimes for some of this stuff. And it's like, how in the world is this human being going to be able to afford that if they got denied from everything else?
And then it becomes your problem to collect it.
Then it becomes your problem. And you have like these collection agencies, but they collect about like 80% of what it is, minus the fees that they charge. That's like their success rate, which is fairly high. But you got to realize, like, they don't get sent to collections for months after the last payment, after they missed their last payment.
That's
So,
just,
like,
that's just
yeah,
more write-offs down the road.
exactly. So let's just assume like the last payment would be 6 months from now. They're probably not going to get sent to collections for another like 3 months after that. So your accounts receivable is like, that's outstanding. It's like through the roof at that point.
Yeah, you can test that 120 day, and you figure you're probably writing off 50% of that.
Yeah, exactly. So I don't know. And then you call the patient, and it's like, you don't want them to go to collections because that doesn't look good for them. And so you're trying to create some sort of new arrangement or whatever. And then sometimes these patients will default on that new arrangement. And you're like, dude, honestly, I don't got time for this. We're going to do, we got to send them to collections to recoup as much as possible.
Yeah.
Yeah, it's things are getting tough for people.
We got a couple more
Again,
listeners, Janina and David.
Location.
Well, I mean, even so, it's like I was talking to my oral surgeon today. I just want to get like a idea of how things are going based off some of his buddies, because this is all kind of like anecdotal at the end of the day.
Right.
But I was like, hey, your buddies like that are working across the country, like obviously everyone's seeing a dip, but like, where are they seeing the least? And he's like, honestly, all my friends that are working in states that have no state income tax, like, they're seeing a dip as well, but it's not as severe as places like California or other places that have income tax. So take that how you will. I think we know the reason why. It's just it's difficult to afford things.
Oh yeah, everything's getting more expensive.
Yeah. And people are getting paid the same. I don't know about you guys, but a lot of stuff around here, the salaries aren't increasing. So
But hey, fixing teeth's fun, right?
Yeah, I mean, at the end of the day, like, we're employable.
Chomper, where are you? What state? What part of the U.S. you in?
I'm like Great Lakes region.
Oh, in New York?
No, no, Great Lakes, like Erie,
Oh, Great Lakes. It's like you said Finger
Erie,
Lake.
Michigan. Yep.
Gotcha. You're in Michigan. Nice. Michigan. Oh, what's it called? Grosse Pointe? You're there?
What's that? Detroit?
Yeah, it's right outside.
No, no, just in that area.
Ah,
But yeah, I'm in like blue collar, 30, 45 minutes outside of Metro.
nice.
Damn, we lost David. I know he's got a DSO
Oh yeah.
or something like that.
Yeah, 20
The
practices.
ortho guy didn't want to hang.
Yeah, we should have invited him next time. Next time.
He didn't request.
That's true. He probably didn't know how to request or was afraid to.
He
So,
got on here. He was like, "Look at these scrubs."
I know, for real.
Yeah,
He's like, none of these people are specialists. Like, one is about to be, and that's it.
Well, and I've talked to him a little bit because I worked for that emergency clinic on the weekend, so he was pretty curious about that with his office, like
Okay.
running emergency shifts on a Saturday while he's not working.
Hmm.
I mean, it could be effective. You just got to have somebody who's confident.
Yep, you just need somebody to work it, and that's
Right.
even what I see at the emergency clinic that I work at. It's like the weekend doctors are the hardest to keep.
Yeah. Because they tend to be the best, and they don't want to work on weekends.
Yeah, exactly.
So it is
Like
what it is.
there's one guy they just hired that has a startup up in Chicago, and he travels and works the weekends there because the startup isn't busy enough yet.
Yeah.
Hmm.
I mean, that's the good thing about dentistry is like we can do those types of things.
Well, and yeah, they're adding specialties all the time. Like what was the most recent Jada had the oral facial pain and the under-recognition of that, but you can go into sleep, you can go into anything.
Yeah.
Dental
That's the thing.
anesthesiology.
Pretty cool. We just got to get over this hump of people not being able to afford shit.
Yeah.
And then we'll see. Maybe a couple months will be the answer. If not, we're fucked.
Yeah, my dental anesthesiology professor only went into it because he couldn't get into the list.
You know, you're not the first person to say that, something along those lines. Yeah, I've heard of that a couple times.
I think that's like the next logical step.
You think
I
so?
mean, they make a lot, dude.
If you're not gonna make it into an OS and you're hell bent on surgery,
But you don't do any surgery whatsoever in dental anesthesia.
yeah.
So
Dude, they make so much money.
I don't think they make as much as you think, and it's hard to find a dental anesthesia job because hospitals want either CRNAs, that's the hot thing right now. They don't want anesthesiologists, they
Yeah.
got to pay them too much. They want CRNAs, and a dental anesthesiologist is going to want an anesthesiologist salary, and it's kind of like,
But you're killing it in a pedo office.
yeah.
Private practice is where you make your money because you have those patients come in and everything is upfront payment, right? So like the one that I use every once in a while, she will charge a flat rate of $500 just for her to walk into the office and $250 an hour, right? And minimum 2 hours.
So a minimum of 1,000 a day.
Well, dude, if she's there for 2 hours, like she's gonna get $1,000.
Yeah.
And are you how many sedation cases can they be running at a time?
Just one. But
Okay.
like at the end of the day, it's like actually they can have people like coming in and out of consciousness.
Yeah.
So I guess like multiple.
No.
And that's kind of
No, you can't do that. No way.
well, you can't do that, but like you can have somebody coming in and out of consciousness, right? So if you time it perfectly, like you're having one completely sedated and that one's coming out of sedation as the next person's coming in. That's why like pedo kills it. Is because they'll time that like that. So they
so you can run 6 surgeries in 5 hours.
Exactly. And so exactly 6 surgeries in 5 hours. Or you'll have one person that's sedated for 2-3 hours or something like that, right? Like they're making a couple $1,000s a day. and lots of times they're working a half day.
Yeah, and you're doing a $20,000 case, so it makes it worth it.
Exactly. You don't have to worry about anything. You just got to work quick because you kind of let the patient know this is what we're going to expect, how long it's going to take for you to get all this taken care of, and book them for 2 hours for that, and it ends up being 3 hours or something like that. Then they're like, well, why the fuck is this an extra 250?
Yeah.
So, but I mean, it is a pretty lucrative, I'd say it's the most lucrative field in dentistry after OS at this point. It's starting to become that.
It's interesting. That's really interesting. 3 year residency. Yeah, I don't know. Perio looks pretty good. They don't have to do anything during residency as far as call and all that BS work that we have to do. And all these, here's my point. All these dental schools, all of them, for the last 5+ years, have been sending all their implants to Perio. So all these dental students don't even know that half of them don't realize that oral surgeons place implants, and implants are the moneymaker in dentistry. Let's be honest. Sedations are great, but it's implants. We all know it, right? And now you have a couple, almost a decade, a couple years, it'll be a decade of dental students going out that only think Perio place implants for the most part. And I don't know. I think that's very interesting.
It is, yeah.
I don't know where it's going to go, but it's something to take note of, because in 10 years, looking back, oral surgeons, I talk to them, they don't recognize that this stuff's going on and how it's going to translate. But I don't know, it's interesting.
I just treatment planned getting the surgical guides made for 2 4-upper implant overdenture cases.
Oh, nice. And
Those are
they
the first
paid,
ones I
they're
kind of ran
committed.
through. They scheduled, so we got down payment for the surgical guide, but
Okay. That's a good step in the right direction. I mean, they've kind of committed at that point. But then again, I had a patient who paid their immediate denture, which is like $1,000, and no showed her $6,000 surgery with my oral surgeon today. So
yeah.
Wow.
yeah,
You
that
want
was it was a bummer. I mean, he would have flew through it in like an hour, if that. But it kind of tanked our day because you're expecting a lot. The whole day is kind of cut in half.
Dude. Did you get in
It is
touch
what
with
it
him?
is.
Anything?
Yeah, that's been the side of on seeing the ownership side. Is like you can look at the schedule and have a great day planned, then you have 2 or 3 no shows. It's just like, well, there it goes.
Yep, that's what it is. Hey guys, I'm gonna run. We should talk about getting like an actual video call set up sometime and record. Definitely try to figure out the spaces and how we can kind of promote this to make this happen a little bit better next time.
Yeah, let's work on it. Beta test. We'll get it.
For sure. All right, guys. I'll see you later.
Absolutely.
All right, good stuff.
See you guys.